You saying that, John. I do think Grassroots America is winning on this issue. They're winning on this issue on the merits because people have actually read the bill, they've listened to the proposal, and they are not convinced it will end up in more cost-effective health care. They're not convinced it will end up in better health care, and they're absolutely convinced it will end up in massively higher taxes, governmental debt, and generational theft from our young people. I am real honored today to have one of the best cardiologists around here with us today, from here in Lumberton, to say a few words. Dr. Sidney Short. Now, Dr. Short tells me that unlike some people in the White House have suggested, he has never cut off anybody's limb unnecessarily just to get an extra fee for service. And I say that kind of jokingly, but really, over the past month, let's just be honest, we've seen the best of America. We've seen people going to town halls and leaving their homes, questioning government action, questioning a proposal that they are concerned is not only bad for them, but bad for our children and grandchildren, concerned about what the makeup of the country is going to be. So we've seen the best of the American people. We've seen the worst of government. Going out and insulting people like you as right-wing mobsters and political terrorists and all kinds of other rhetoric that has no place in a free society. And we've seen our doctors and medical professionals insulted, and even referred to as some of the White House staff as butchers going around and removing limbs for extra money. Now, that's just, that's outrageous, insulting, and untrue. And that's why we want to have a great doctor like Dr. Short come up here and say a couple words. Thanks.
Thank you. I'll be very brief. I was asked this morning, why am I so concerned about the healthcare situation? And the most important reason is because I'm a doctor, my wife's a nurse, we've experienced the healthcare, but also we have 5 children at home, and I don't want their futures to be bankrupt. I think we need to stop spending until we control the deficit that we have, and then we can go forward. Clearly, healthcare needs some reform. I'll be the first one to admit that. But I'm unusual from this situation that I have worked and lived overseas in countries that have government-controlled health care. I did part of my medical training in England. I later lived in China, and I've seen terrible things happen in the healthcare situation. As a cardiologist, we do heart cath studies, we do interventional procedures to help people having heart attacks, having chest pain. And when I lived overseas, I saw many circumstances where a patient would need further health care, and before that procedure was done, actually someone was sent out of the room to go ask the family if they could afford it, or ask if the government would allow it, and if the answer was no, then the patient did not get that health care. And in those circumstances, the patient would often leave the hospital with inadequate health care. Now, in America, we live here in a wonderful society that has some problems, but the health care is the best in the world. We have many studies that show that the healthcare outcomes are the best that is possible in the world right now. And I'm concerned that that would change greatly with the proposed healthcare plan. Not only would many physicians would find it hard to practice in the new plan that they're proposing, but also there would probably be many doctors leaving healthcare. And right now there's already a doctor shortage. And we need to make sure that we encourage those young doctors to come into the healthcare system to provide healthcare to the ever-enlarging elderly population who needs healthcare. I'm concerned that the new healthcare plan would shift the people who are not getting healthcare from the people who are currently not getting healthcare. It would be shifted to the elderly who would be denied or rationed healthcare, and they would be even a greater number of people who would lack healthcare. Here in Robeson County, we have a good healthcare system. We are actually one of the poorest counties in the United States. And I want you to know that no patient who comes to the hospital is ever turned away because they can't pay for it. No patient that ever comes to our office is ever turned away because they don't have money to pay for it. And the patients who need procedures at the hospital, we never stop and check to see if they have money or not. We never stop and check on their insurance. We do what's best for that patient first, and then we help later. If they can't pay for it, there are many systems to set up to help them get their medications and also pay for their health care. So clearly we can make some improvements on that, but we can't destroy the system that we have and go to a system that would be much more difficult. So please keep working on this. Thank you very much.
Thanks very much, John. Appreciate your good work. Thank you so much.